Now, your health, your safety. This is ABC7 News.
Good afternoon, I'm Kristen Z. Welcome to our daily special called Getting Answers. We're asking experts your question every day at 3 o'clock to get answers for you in real time on all things coronavirus. So you can post your questions on our Facebook live stream, YouTube Live, or check out our Instagram stories to submit a question. So today we are happy to have back our special correspondent, Dr. Alok Patel. Dr. Patel, as you know, has been here for us answering countless questions about COVID-19, treatments, tests, and what you should do to stay safe. And he is ready to do it again after doing a lot of research. So thanks to those of you who have already submitted questions. If you haven't yet, go to our Facebook page, ABC7 News' Facebook page, and put in your question, and I will definitely try to get to that if we can during our program. We've already gotten some really good ones, and we just want to see more of them coming so that we can address that with Dr. Patel. There are so many interesting new medical developments to cover right now. We want to talk about herd immunity with Dr. Patel. We also want to talk about reinfection. We want to talk about just how far the droplets from COVID-19 can travel and whether that's influencing your decision to wear a mask or not. As you know, there's been a lot of back and forth on that. And now that there are a lot of tests, more people doing tests, you know, there are also people getting false negatives. And what is the impact of that as far as our overall, you know, immunity and how safe we are as we start to think about reopening. So with all that in mind, we want to welcome Dr. Alok Patel. Hey, Alok.
Thank you. Great to be here to answer all these questions.
That's great. I just rattled them off while you were getting yourself ready. But let's start from this one, because a lot of people have been asking, you know, whether we hear our governor speak or Mayor London Breed or in New York, Governor Andrew Cuomo, it seems like everyone is suggesting we are peaking in terms of the cases, the hospitalizations. Is that actually the case? Does the medical community feel safe saying we are at about the peak if we are doing what we're doing?
I think the medical community does, in fact, feel optimistic about kind of the plateauing or the slowing of cases. But again, we're also being realistic because we know that there's a potential for not only another surge of cases that could happen in the next following weeks, but also we have to be really careful about the fact that there could be rebound transmission, meaning if we were to reopen the economy and get people back out into the workforce, we could have more cases kind of pop up. And so we still need a little bit of time to make sure we not only have a slowing down of cases, but we see a decline of cases over the course of at least a couple weeks.
All right. So given that, then, what is the ramification for reopening? As you heard yesterday, Governor Newsom said, ask me again in 2 weeks. But these are the 6, you know, requirements that we're going to use, indicators that we're going to look at to decide whether we are ready to reopen slowly. Realistically, based on everything we know about the spread, the results we have from testing, and granted, there's a lot we don't know from testing right now either. What does that timeline look like?
Well, like I mentioned, the timeline really needs to show us seeing a slowing of cases over an extended period of time. And so we need to be able to see that 14 days. And that, again, that's a conservative estimate. And we need to see a continuous decline in cases. Now, as we see that, we have to see no staffing or equipment shortages in our hospitals. Remember that flattening the peak model, we want to make sure that the hospital systems actually maintain and that we don't have a risk of them being overwhelmed if we had more cases. And while all this is happening, we need to see more availability in testing and ability to be able to surveillance every active case. We actually need all of it in place before we start to reopen society.
Well, one thing should help, which is the San Francisco partnership with UCSF, as you know, that is going to start doing contact tracing on a much bigger scale and tracking every case and the people they were in contact with and the people they were in contact with. So that's good. I want to fold in a question from an Instagram viewer. Do you have any updates on the antibody tests? How does it work?
Great question. And, you know, I would love to be able to see a consistent, accurate antibody test available to everyone. We don't have that right now. So where we're at with the antibody test, there is only one that's currently FDA approved, and there's about 90 that are on the market. And so what the antibody test is essentially looking for is an immune response to anyone who may have had COVID-19 in the past. And so it doesn't tell you if you have an active infection, it tells you if you had it in the past and if you might be immune. I say might be immune because if you get any infection, you get antibodies. But as of right now, we don't know who's immune or how long that immunity lasts. Now, we heard Mike Pence earlier saying that there are going to be millions of tests available across the country. We're waiting to see that happen. And this is going to be a really important step because we want to know if we have widespread immunity, if people have seen this before we start to really reopen society. We have to have that serology or antibody test available.
Yeah, that is what we refer to as herd immunity, right? When enough of us have been exposed. And right now we just don't know. So Coco is asking, and this is a good question that relates, I think, is everyone going to eventually get COVID-19? And how at risk are children? And when she asks, is everyone going to eventually get it? I know we're not eventually all going to get sick from it, but are we all eventually going to get it, as in be exposed and affected and produce antibodies?
So a couple compounded questions in here. I think the first thing we should mention is it is possible a large percentage of this population over time is going to come in contact with COVID-19. And that's why there's a lot of talk right now about saying, you know what, even if we see a slowing of the virus during summer, we have to be prepared for a recurrence this winter and the following winter. And we have to make sure that even if we think that we're safe, there might be still people who are vulnerable out there and our healthcare system could get overwhelmed again. Now, I just want to make sure people understand what we mean when we say herd immunity. Herd immunity basically states that if enough people in a population are immune to a virus, it's much harder for the virus to spread or for people to catch it. Now, for coronavirus, we're estimating that we need about 60% of the population immune to it in order to really stop that spread. And the safest way to do that is with a vaccine, where you can establish widespread immunity a lot safer and a lot more efficiently. But we know we're at least a year away from doing that. And to tack on the last question, kids right now, we are, again, seeing that they're faring a little bit better against the disease. But that doesn't, first of all, mean that they can't get severe illness. But we also know that they're a huge vector to transmit it. They can be contagious even if they have no symptoms.
Okay, so given that, for now, the safest thing without a vaccine anytime soon is to continue to wear our masks when we're out in public, or face covering, I should say. So to that end, I want to address Salvador's question, which is why not use furnace filter material as face mask inserts? They are rated for viruses. What do you think about that idea?
So in theory, there are some materials out there which can actually filter a lot of particles. Not only the furnace material I believe he's referring to, but even something like a vacuum cleaner bag, which has been shown to filter out a lot of viruses. Here's the issue. You have to be able to breathe through that, which is not the easiest thing to do. Even a medical grade mask is difficult to breathe in for a long period of time, especially if you have heart or lung disease. And you have to be able to wear that, not only breathe through it, but it also has to have a nice snug fit around your face. And so when we talk about cloth materials or things people can do at home, you have to remember that it's got to be comfortable enough for someone to wear and not constantly be readjusting or moving around. And so just because the material is really good at filtering doesn't mean it's the best thing for your face.
Right. All right. A paper towel, I think, may actually work better, is what I've heard from some other doctors. You agree?
Until it gets wet.
Until it gets wet.
And I think that's an issue.
Okay.
A paper towel.
I know, don't you love this awkward occasional pauses because we're in two different places? But anyway, you know what? Let's take a quick break on the air.
Times of COVID.
I know, right? All right, we're doing the best we can, and I know folks are, appreciating that, so no worries. We're going to take a break on the air, go over to our live streams platform, and continue to answer questions there right now. All right, so Loke, let's continue. I want to ask Lawrence's question, which is, people are told they should keep 6 feet apart. How are physicians handling this?
In the hospital, we're doing our best to actually try to limit the amount of unnecessary patient interactions, even if we go down to certain central areas, whether it be a lab or even getting coffee in the middle of the night in the hospital. We still are doing our best to kind of maintain that physical distancing. Now, obviously, in the hospital wards, when you're taking care of patients, that's not always possible. But we're being very diligent about, hand washing, personal hygiene, and wearing masks. We're wearing masks constantly in the hospital.
Yeah, but this is why we talk about frontline workers, hospital workers being more exposed, because it is hard for you to maintain that social distancing. And even with all the proper precautions, sometimes you still get it. But also I want to address that 6 feet. In the past day or two, I've read some articles about how 6 feet may not be enough, that it's a continuum. There isn't a magic number, but that, sometimes you might need 8 or 10 feet, depending on how that is being spread, like if somebody sneezes at you. Can you address what really, truly might be a safe distance?
I think it's tough to pin a number on it. What people need to understand, and this can all be affected by, like you mentioned, if somebody is sneezing, and also what kind of space you're in. Because an area with poor ventilation or an enclosed space, your aerosolization, or the way the virus spreads through the air, is going to be completely different. There was a model that was kind of circulating the internet, and it showed the virus spreading in a grocery store aisle. Now, I haven't been able to validate that model, but again, a grocery store with narrow aisles, with the ceiling, is completely different than you being outside.
All right, we're going back on air.
So I would just pay attention to your environment.
Okay, thanks. Let's go back on air. All right, we're back with our special correspondent, Dr. Alok Patel, to answer more of your questions about COVID-19 and where we stand now. I'm going to combine Nelson's question and Jennifer's question. Nelson wants to know, what is the treatment in hospital for people who do have COVID-19? So what's the treatment? And Jennifer asked, if you go to the hospitals, how do they decide who gets hydroxychloroquine?
Those are two great questions. To address the first one, the one thing I'm hearing from my colleagues who work in ICUs or lung doctors is every patient is different. It depends on the patient's age, how the patient's respiratory status, how their breathing status is doing, and if they have any other medical conditions. And so there isn't necessarily a standard of care, but there are patterns. So some doctors are saying a lot of the patients need oxygen really early. Some are actually just needing supportive care and being monitored closely and then are able to go home a lot faster, but it really varies. Now, regarding hydroxychloroquine, great question. I think it's really important to address this. Some hospitals across the country are using hydroxychloroquine. However, it's under a controlled setting. They're doing very close monitoring, especially of the heart rhythm on all these patients, and it's under expert guidance. And it's usually going to be done in a kind of a clinical trial setting. And so the way they decide it is really based on the institution and what they're currently doing with their patients with that. But there is no general rule right now. That's what we want to get to. We want to be able to understand in general who can safely get these treatments, including hydroxychloroquine.
Right, there are a lot of trials going on. Oh, speaking of that, there's a Brazilian chloroquine study that you wanted to bring up, right?
I did want to bring it up. In the very beginning, when President Trump said, hydroxychloroquine could be a game changer, everyone was optimistic. Everyone in the medical community says, we hope it can be, but we have to study it for its safety. And a study in Brazil was basically looking at hospitalized patients. They were giving these patients a lower dose and a higher dose of chloroquine, which is another version of hydroxychloroquine. And what they saw was the higher dose of chloroquine was associated with heart arrhythmias, or irregular heart rhythms. And the study was actually called off after several patients died. And so what this told us was that we have to be very careful about who gets these medications, which is why there needs to be more studies and more data so we know what a safe dose is, who should get it, and what exactly we're dealing with, instead of just kind of wildly distributing this medication. And why we say once again that nobody should be hoarding these meds or trying to take them at home.
Right.
As we've seen, it can be deadly.
All right, Teresa Carlson asked a question that I think a lot of people are wondering. Can you get a test even if you don't have symptoms? You can't, right?
Right now, it's very difficult, if not impossible, to do that. And Teresa, this is a great question, because we want to be able to test people who may not have any symptoms but may have been in contact with somebody. Right now, you might be able to do that through a private company, but we don't have the testing availability generally to do that. Now, in the future, we love to be able to test everyone with something like an antibody test, because even if you don't have symptoms and you may have had COVID-19 in the past, you theoretically should have antibodies against it. And so that's where we want to get to in the future. We have to be able to determine how widespread this disease is now and who may have had it in the past.
All right. Well, based on the way things are going right now, Marcy wants to know how probable will youth sports resume this summer or year? How probable it is what I guess she's saying. And based on what Governor Newsom said yesterday, I'm going to guess not that probable, right? Certainly not by summer. What do you think?
I think we can hope for the best, but plan for this to not happen. You have to think about youth sports not only depending on the sport, obviously, but kids are going to be in close proximity to one another. There's also going to be parents and coaches, and there's going to be a potential for people to get too close and re-spread this. Now, again, when we talk about reopening society, there's going to be a strategic reopening. And so we very may, in the middle or end of summer, look at specific businesses and services and decide, this could reopen with the physical distancing parameters still in place, if that makes any sense. And so it's possible certain activities we may be able to kind of reopen within these guidelines, but I wouldn't expect people to have full bleachers and full Little League games, going by 4th of July. I would just be realistic about this.
It's going to be case by case, looking at the particulars of that event or sport, and it's going to base, also on how we're doing in terms of cases by that point. So, yeah, okay, no firm answers. But we're going to take a break on air and continue our questions and answers on our live streams and be back in a couple minutes. All right, we are in break with Dr. Alok Patel, our special correspondent, who's here to answer our questions with regard to the coronavirus. Eduardo wants to know if universities have the privilege to have testing kits available on campus. I assume he might be a student on one of these campuses.
I have heard that some universities have different capabilities than other ones do at their health centers, and it really just depends on what state universities are in, what counties they're in, and what health systems they're associated with, which is a problem. Depending on what state you're in, what university that state's in,
Where are they?
They may have a huge backlog of testing. And so, they may not have the right supplies. And so I don't think there's an equal answer for all the universities right now.
Okay. Sorry. Alok, guess what? Our lovely producer that you and I both love was talking to me at the same time. Oh, there he is, the voice of God. All right, so now see.
What did you tell me? What's happening?
No, he was just, blah, blah. This is live TV, folks. So now you see how it works, right? Actually, I have this earpiece, and Alok, you got your earpiece as well, right?
Fixing my tie,
Yep.
I'm fixing my glasses, I'm fixing wires.
And by the way, your hair still looks really good. Have you taken the scissors to yourself yet? Have you gone?
So true story. We're all adjusting. I've been cutting my own hair since 2004.
What? Seriously?
Yeah, true story.
No wonder. I mean, you're not missing a beat. That's because you've been your hairdresser forever, so you've got the same style, and it looks great.
Yeah.
All right,
Thank you. I started doing it in college.
Oh, I see. Sure. In college. Right. You're like, why would I pay for someone to do it? Right. I can barely afford tuition as it is. All right. We're coming back on air with Dr. Alok Patel. All right, we're back with our special correspondent, Dr. Alok Patel. We only have a few minutes left with him, so let's do a few rapid-fire questions. You warmed up? You ready?
I'm warmed up. Let's go.
Okay, let's go. Can you get it from food?
Not from the food itself. It's very, very low likelihood you can get it from the food itself. I would worry more about the packaging. You know what to do. Wash your hands, be careful with the packaging, and even if you absolutely have a doubt, it's not going to survive that long on food anyway. If it's canned food or something, put it aside. Wait 24 to 72 hours. It should be dead.
Can anything over the counter prevent this?
So things over the counter are going to be able to disinfect your hands or your surfaces, but there is nothing out there that's going to boost your immune system or prevent COVID-19 or even treat it. Do not listen to any of those ads you see on social media. A lot of people are trying to profit right now off the fact that people are scared and want an answer. We don't have any treatments available just yet. Just do what you're doing, stay home, and use those hygiene guidelines.
Is it necessary to use cleaners on the groceries and packages you pick up at stores in case the virus is on it?
I would. you know, if you're getting deliveries or packages and you have any concern, you know, it's totally fine to wipe down the surfaces, your shopping cart, whatever it may be, or you can always remove the item outside of your place, then take it and then wash your hands. Remember, as long as you're washing the contact point between a surface or a contaminated place and your eyes, nose, or mouth, you should be safe.
Will we be social distancing until 2022?
People saw that headline and it was rightfully scary. Now that model that told us that we might be socially distancing until 2022 is based on how other coronaviruses in the past have spread and the fact that we could see this virus pop up again this winter. Now, we need to make sure that we're prepared for a resurgence. So we need to make sure our hospital capacities are ready and that we have some type of physical distancing in our expectation, but it basically just kind of puts a little bit of more pressure on the fact that we need treatments, we need a vaccine, and we need to be realistic about reopening the economy.
All right, David asked, do I need to disinfect my shoes after a walk in my neighborhood to help avoid contact with the virus?
So it's not likely that the virus would be sitting alive on a concrete surface for days on end. If you do have a concern about it, I would wipe your shoes down, or I would leave your shoes outside the house, or I preferably not want to put your shoes anywhere where you may be touching and then subsequently touching something else. Remember, it can kind of hop around through surfaces. And so again, I understand why the questions are being asked, but just think about what the last contact point is between the virus and your eyes, nose, or mouth. And so as long as you're kind of breaking that with disinfecting, you should be okay. But you know what? When I come from the hospital, my shoes sit outside our apartment.
Excellent. All right, great tips. Thank you so much, Dr. Alok Patel. We'll continue this conversation with Dr. Patel on our live streams right now and take a break on air. And when we come back on air, you're going to love this story. We'll have more when we come back.
We are in commercial break.
All right, Dr. Patel, you're back on Facebook. Here we are. I want to ask you, this is not really rapid fire, but I do want to ask you what you think about the U.S. government temporarily withholding funding to the WHO, WHO, the World Health Organization, what the implications are. What does that mean for us?
I think the first thing that stood out to people was that there could be a political element involved, and that's something that we don't want to see in headlines right now. We want to all be unified and focused on stopping this pandemic. And we need to remind ourselves that even though some experts and journalists agree that the WHO was a little late in calling this a pandemic, and there may have been some issues with information early on, that doesn't take away from the fact that they're a major humanitarian organization. They're a key player in global surveillance, and they really are at the front line of a lot of infectious diseases. They're the reason we don't see smallpox anymore. They're the reason that polio is almost eradicated. They're on the front lines with Ebola, and they're active in so many different countries. And so halting funding seems really abrupt, you know, and it seems like a very rash decision. Instead, it could be possible that there could be some discussion about regulation or how we can, you know, change things moving forward. But, you know, that headline saying that funding might be cut, that got everyone's alarm bells going for good reason.
Well,
because there really is no replacement for them.
The way things are going these days, I wouldn't be surprised if there's a headline a day or two later reversing that temporary announcement and saying, actually, we're not. So we'll see. We'll see. Okay, we're going to come back.
Sometimes things are said impulsively by people. I'm not going to name any names.
Sometimes. Like I just say, hey, Dr. Patel, I'm mad at you. You're not coming over to dinner when this is all over. But then the next day I'll say, you're my friend again, right? All right, we're coming back on. All right, we're back
You'd be like,
on
after
ABC7
deliberation,
News.
Dr. Patel's re-invited to dinner.
All right. If you were hearing Dr. Patel asking me to join him for dinner when this is all over as friends and colleagues, that's because you missed our very fun and engaging live stream conversation that we always have when we're in commercial break. Dr. Patel, thank you so very much for all that great information. And yes, let's get the whole gang together and do dinner when we are all able to do so safely. Take it easy.
In due time. Thank you. Stay safe.
You too. Okay, right now you are really going to love the story. I'm very excited about it. We're going to talk with our next guest. He is a Burlingame police officer, and he's a real hero. Not only has he recovered from COVID-19, now he's hoping his blood can help others. Joining us today, Officer Steve Vega. How are you doing, Officer Vega? Hey, Officer Vega, can you hear us?
Yes, I think I can hear you.
Yay! Yes, happy to hear you and see you looking so well because I know you had just.
Actually, I can barely hear you.
Oh, you can barely hear me. Okay, I'm going to try it. Let's give it a shot because I want folks to hear your story. You just recovered from the coronavirus. Walk me through it. When did you realize you were sick?
I realized I was sick roughly March 5th.
And how did you know? What was happening to you? Symptoms?
At March 5th, I was just displaying some basic symptoms. And they just were coming and going. And then like a week later, the symptoms came back and they were persistent. They weren't going away to the point my doctor wanted to see me and get an evaluation.
So you went in and got a test and found out you were COVID-19 positive, right? Were you hospitalized? What meds did you take?
No, the test I went and got was a chest x-ray, and I had the beginning stages of pneumonia. 2 days later, I had the COVID test, and then 3 days later, they tested positive.
Oh. Can you tell me how bad it got and if you were ever worried that I wonder if I'm going to make it?
Yes, once I heard the positive results, I was extremely worried, concerned, not knowing what's going to happen to me. Am I going to get hospitalized? Am I put on a ventilator? What's going to happen next to me based on what was happening here in the States? A lot of concern and worry, and on top of the illness, extremely pain when I was coughing, fever, slight fever, chills, aches, etc.
Now, when did you start getting better?
I'm sorry?
I can see you're better now. You're back at work, which is great to see. I know it's been tough, but now that you are better, you want to help others. I understand you're enrolled in a Stanford trial in which you're going to use your blood and your antibodies, right, to help others. Can you explain what's going to happen there?
Yeah, once I got to the point of feeling better, back to work, I knew I recovered from this basically all on my own. With a will to fight and fight through this. And I started doing some research because I started hearing about things on the TV about testing and antibodies, so blood donations, plasma, etc. So I researched it and found that both the American Red Cross and the Stanford Blood Center were looking for patients that recovered. And I felt I was a strong candidate. Reached out to the Stanford Blood Center, finally got a hold of them, gave them my details, and they were highly interested in my plasma and wanting me to come in and provide.
And I understand you're one of the first to sign on to this. Can I just ask you, why did you do it? Is it the same heart that motivated you to become a police officer?
That's part. It's kind of two-part. Yeah, that's part of me and why I'm in the job I'm in. I just love helping people, working with kids, etc. But that's just me in general. If I can give something back, knowing what's going on in a society today with this disease, people are sick, people are dying.
Yep.
And I'm just like, well, I got through this on my own. And they want my plasma, and this could be helpful. And I am going to do this, and hopefully it helps.
Yep.
And
I have to say,
I'm able to save a life or make somebody better as a result of me.
Thank you. Officer Steve Vega, much respect to you. I'm so glad you've recovered, and thank you for being on the front lines, protecting us and helping us. And I want to thank you all for joining us today for our interactive show, Getting Answers. We'll be back here tomorrow at 3 o'clock. World News Tonight is next. Take care. I know. Thank you, Steve.